Hi, it's Zuri. Have you ever wondered why so many people overlook the connection between mental health issues and gun violence? It's a conversation that's often avoided. But understanding this link could be crucial for prevention. Today, we're diving into the shocking link between guns and mental health. And what we're about to explore might just change everything. In recent years, the United States has seen a staggering number of mass shootings, leaving countless lives lost and families shattered. While the debate around gun control rages on, there's a critical aspect that's often overlooked: the role mental health plays in these tragic events. Gun violence is on the rise, and it's time we acknowledge the often overlooked elephant in the room. Mental health is an issue that affects millions of Americans. And yet, when it comes to gun ownership, we often turn a blind eye to the very real connection between the two. We're not just talking about the obvious cases where mental illness contributes to violent behavior. We're talking about the subtle, underlying issues that can lead to devastating consequences. From anxiety to depression, the spectrum of mental health issues is vast. And yet, we rarely consider how these conditions might impact a person's ability to safely own a firearm. It's time we confront the uncomfortable truth: our lack of attention to mental health is putting lives at risk. When it comes to the relationship between mental health and gun access, the research is clear: there's a direct link between the two. Studies have consistently shown that individuals with a history of mental health issues are more likely to engage in violent behavior, including gun violence. In fact, a recent study published in the Journal of the American Medical Association found that individuals with schizophrenia, bipolar disorder, and major depressive disorder were significantly more likely to be involved in a shooting. These findings are stark, and they highlight just how critical it is that we address this issue head-on. But it's not just about the numbers. It's about the human cost. We've seen it time and time again. A person struggling with mental health issues, often without access to the support they need, reaches a breaking point, and tragedy unfolds.
Hey there. Let's talk about something that's been a hot topic for a while now: gun violence and mental health. It's a heavy subject, but stick with me. We're going to break down some important points that might just change how you see this issue. First up, gun violence in Minnesota. Recently, we've seen tragic events like the Appalachia High School shooting that highlight the growing issue of gun violence. Did you know that a study by Professors Gillian Peterson and James Densley found many Minnesotans have faced gun threats or injuries? Black residents, in particular, have been disproportionately affected. This isn't just about physical harm. The mental health impacts are profound. Think anxiety, depression, PTSD. So, what can we do? The study suggests promoting safe gun storage and increasing access to mental health resources. It's clear we need a multifaceted approach to tackle this. And guess what? There's a summit at Hamline University on November 1st, bringing together experts and community members to find solutions. It's a big step towards a safer Minnesota. Now let's pivot to a groundbreaking study by Oregon Health and Science University. This one challenges a major misconception: that mental illness is the main driver of gun violence in the U.S. Dr. Archie Bleer, the study's lead author, found that Americans are 20 times more likely to die from firearm-related incidents compared to people in 40 other countries, despite having similar rates of mental health issues. Shocking, right? The real kicker? The U.S. has seen a 23% increase in firearm deaths since 2000, while other countries have seen a 27% decrease. This study makes it clear: it's not just about mental health, it's about the sheer number of firearms in circulation. Dr. Bleer stresses safe storage practices and reducing firearm availability as crucial steps. We need to shift our focus from solely blaming mental health to considering the role of firearm accessibility. So, what's the takeaway here? While mental health is an important piece of the puzzle, it's not the only one. Addressing gun violence requires looking at all factors, including the number of guns out there. If we want real change, we need to tackle this issue from every angle. This means involving everyone from policymakers to community members.
One of the most surprising findings is that many mass shooters have a history of mental health issues. But they also have something else in common: easy access to firearms. This raises a critical question: what if we'd addressed their mental health issues before they had access to a gun? In a stunning revelation, the 2018 report on gun violence and mental health found that a majority of mass shooters had prior contact with mental health professionals. But the red flags were often ignored or overlooked. This is a wake-up call. We need to do better. The link between mental health and gun violence is complex. But one thing is clear: we can't afford to ignore it any longer. It's time we acknowledge the critical role mental health plays in preventing gun violence. In conclusion, the connection between mental health and gun violence is a conversation we can no longer afford to avoid. By acknowledging this link and taking concrete steps to address it, we can start to prevent these tragedies from occurring. Thanks for watching. Don't forget to share your thoughts in the comments below and subscribe. If you're interested in learning more about the intersection of mental health and gun safety, or any other topics, be sure to check out Zuri's Resilient Network.